Hello everyone, a very good morning to all of you. So today let's talk about salivary gland. Okay, so before moving into the salivary gland, I'll discuss the very basics of salivary gland. You should know what is parenchyma, what is stroma, what is myoepithelial cells, what is lobe, lobules, all these steps. So once you know the basics of a salivary gland, any tumor or a carcinoma you put over it, it will get understood, or you can orient all these kind of basic terminologies with the tumor. Okay, so any organ, it will have three important coverings or structures. Okay, parenchyma, stroma, and what is called as capsule. So what do you mean by parenchyma? Parenchyma is the functional component of a gland. So functional component of gland. What do you mean by that? See, when I say a parenchyma of a salivary gland, it means it is responsible for the salivary secretion or production or excretion or expulsion of the saliva. It has some functions related to the gland. That is why I am calling it as parenchyma. Okay, so parenchyma of the salivary gland can be of ductal, acinar, and myoepithelial cells. Okay, it can be a ductal, acinar, myoepithelial. As I told you, parenchyma, functional component. Now these cells should have functions, right? So the ductal cells, if you see, it can be of intercalated, striated, or excretory ducts. Acinar cells can be serous or mucus. Okay, and the myoepithelial cells, if you see, they are specialized form. They are responsible for contraction of the epithelium. Okay, in that way it helps in expulsion of the saliva into the oral cavity. Okay, so these are contractile cells. They are responsible for expulsion of saliva. Okay, so these three, that is the ductal, acinar, and the myoepithelials, forms the parenchyma of the salivary gland. So parenchyma, functional component. Okay, now what is the function of a ductal cells? It is going to transport and modify the saliva. Transport and modify the saliva. In what way it modifies? It will remove the ions and it will make the saliva hypotonic. Okay, so the function of the ductal cells will be transport and modify the saliva and make the saliva hypotonic. It will be expelled by a myoepithelial cells. And the acinar cells is responsible for the secretion of saliva. Okay, it is responsible for secretion of saliva. So the parenchymal component is a functional component of the salivary gland. These cells will have certain functions, or it will have the major role in the secretion of the substances produced by the gland. In that way, the parenchyma of the salivary gland will have ductal, acinar, myoepithelial cells. Ductal cells will be intercalated, striated, and excretory ducts. Acinar will be serous and mucus. Myoepithelial cells will be the specialized form, the contractile cells, expulsion of saliva. Ductal cells is responsible for transport and modification of saliva and making the saliva to hypotonic, and acinar cells will be helpful for secretion of saliva. So this will form the parenchymal component of the salivary gland, the functional component. The next one will be stroma. Stroma will form the non-functional component. What do you mean by that? It just gives the framework to the gland. Okay, it gives framework, structural support. It gives a framework or structural support to the gland. Okay, so what is the stroma? Stroma, in a very simple term, means connective tissue. Okay, stroma in a very simple terms means connective tissue. So what are the connective tissue will do? The connective tissue will have nerves, blood vessels, lymphatics, okay, and also ground substances. So the connective tissue will have nerves, blood vessels, lymphatics, ground substances. All those things will be present in the stroma, the connective tissue, structural component, framework to the gland. Okay. Now, What do you mean by a capsule? Capsule is the one that divides the gland into lobes and lobules. Okay, say for example, take parotid gland. Parotid gland will have superficial and deep lobes. So a single gland is separated into lobes. Imagine a cricket ball. I'm cutting the cricket ball into multiple round pieces, but it is one as such, but I'm cutting it into multiple round pieces and calling it as lobes. Okay, so each lobes will have multiple lobules. That is different. So these lobes are basically connective tissue septa separating or dividing the gland. Okay, so these capsules are connective tissue septa. To be specific, lobes are connective tissue septa. So you will have the gland will be divided into multiple portions, which is nothing but we call it as lobes. It has a connective tissue septa, connective tissue covering over it. Okay, so that is called as lobes. Lobes will have parenchyma and stroma. Okay, I'm just dividing the gland. That is called as lobes and lobules, the capsule. Okay, now moving on. Now we are going to discuss the most common benign salivary gland tumor, which is nothing but the pleomorphic adenoma. Pleomorphic adenoma. So pleomorphic adenoma, as the name suggests, pleomorphism, multiple forms of adenoma, salivary gland tumor. So why it is pleomorphic is, now we are going to understand, it has both ductal and the myoepithelial components. So it will have epithelial component, and also one important function of the myoepithelial cells apart from this contractile activities, it is helpful in production of extracellular matrix. What do you mean by extracellular matrix? That is a stromal component. So the myoepithelial cells also help to form the stromal components. It will secrete what is called as collagen, or it will secrete certain substances that is responsible for the formation of, or that is responsible for the addition of the stroma. Say for example, a stroma has ground substances. Myoepithelial cells will secrete ground substances, collagen, okay, extracellular matrix. So it is helping the connective tissue. So it is not a true connective tissue, but it is helpful for the formation of stroma. So this pleomorphic adenoma, because I say it is formed by myoepithelial and the ductal cells, am I right in saying that it will have the ducts, the cords, all those things, and the myoepithelial component, that is, it will have ground substances, and also it will exhibit in various forms. Okay, so the myoepithelial cells can be of four. It is seen in histopathological feature as four forms. It can be myxoid, that is a gelatinous form, or it can be chondroid, that is a cartilage like, or it can be hyaline form. So hyalinization will be seen. So that is why in pleomorphic adenoma, because of the presence of ductal and myoepithelial cells indirectly helps in stroma formation, and myoepithelial cells will be exhibiting in different forms, that is myxoid, chondroid, and hyaline. You see all these in histopathological features. Okay, so the pleomorphic adenoma is a common benign tumor of the salivary gland. 60 to 70% of the tumors are these pleomorphic adenoma, and the pleomorphic adenoma is caused by what is called as the pleomorphic adenoma activator gene 1. So what happens, this pleomorphic adenoma activator gene 1 is normally present in adults. It will be in a very low unexpressed form, but due to some genetic reasons, the pleomorphic adenoma is genetically inherited. It is not because of any cause. So because of some genetic causes, this PLAG1 is going to get stimulated. Okay, it is going to get stimulated, and it is going to induce what is called as IG1, insulin growth factors, so, or IGF1. Okay, so this IGF1 is going to result in increased cell proliferation. Okay, it is going to result in increased cell proliferation, and anti-apoptosis will be induced. So what happens, the cell death is not going to take place, the physiological cell death, and at the same time the cells proliferate. So what happens, that becomes a tumor. So pleomorphic adenoma, the main pathophysiology, it is genetically inherited. PLAG1, pleomorphic adenoma activator gene 1. So it is normally present in adults, but it is expressed in low or unexpressed forms. But because once it is getting activated, it is going to stimulate insulin-like growth factors 1, that is going to result in engaged cell proliferation and anti-apoptosis, which is result in tumor formation. So this is the basic pathogenesis. So now, since we are talking the pleomorphic adenoma in surgical aspect, I'll be discussing about a few very important surgeries which you will do in case of pleomorphic adenoma. Okay. So in immunohistochemistry for pleomorphic adenoma, you can see what is called as the cytokeratin positive if there is presence of epithelium. For myoepithelial component, you can go for S100. So very important previous year question. So immunohistochemistry for pleomorphic adenoma, epithelial cells cytokeratin will be positive, myoepithelial cells S100 will be positive. So because the pleomorphic adenoma has epithelial and myoepithelial components, so myoepithelial is helpful for synthesis of stroma. That is why you see a variety of histopathological features like myxoid, chondroid, hyaline features. Okay. Now, what is this carcinoma x pleomorphic adenoma? So when this pleomorphic adenoma is induced or it is stimulated by certain other genetic mutations like P53. So P53 gene mutation results in the shifting of this benign tumor into a carcinogenic one, malignant one. Okay, so it is called as carcinoma x pleomorphic adenoma. Okay, so pleomorphic adenoma can also be malignant if there is a P53 gene mutation in addition to the plaque one. Okay, now moving on to the treatment aspect, very important. So first we'll talk about parotid gland as it is most common. So parotid gland, the most commonly pleomorphic adenoma affects the parotid gland, which is followed by the submandibular and palatal glands. This minor salivary glands is also most common. Most commonly involves the palate. Okay. So parotid gland tumors, as I told you, parotid gland will have two lobes. What are they? Superficial and deep lobes. So if the pleomorphic adenoma is involving only the superficial lobe of the parotid gland, I will do a superficial parotidectomy. Okay, I'll do a superficial parotidectomy. What do you mean by superficial parotidectomy? I'll remove the superficial lobe plus I'll try to preserve the facial nerve. Now you can ask me, why can't I do enucleation alone? What do you mean by enucleation? Enucleation is I'm just scooping out the lesion, I'm just removing the nuclear component, I'm not removing the touching the normal tissue. So what happens in pleomorphic adenoma is there will be something called as pseudopodial extensions. These pseudopodial extensions, it will extend into the normal cells. So they will extend into the normal cells. So that is why when I see a pleomorphic adenoma involving a superficial lobe, whatever it may be, even the lesser portion or the middle portion, I'll try to remove the entire superficial lobe. Why? Because the pseudopodial extensions will be into the normal tissue. When I do a simple enucleation, there will be presence or there will be recurrence of the pleomorphic adenoma again because of the persistence of pseudopodial cells, the pseudopodial extensions into the normal cells. So superficial parotidectomy, if the superficial lobe is involved, I should completely remove the superficial lobe, preserve the facial lobe. If the parotid gland is involving the deep, then I'll go for total conservative parotidectomy. Total conservative parotidectomy. Okay, so I'll remove the entire parotid gland and I will try to preserve the facial nerve. Okay, what happens if there is an X carcinoma in situ cases? I'll go for total parotidectomy plus removal of facial nerve and I'll go for neck dissection if there is a lymph node involvement. Okay, this is about parotid gland. Submandibular gland, I will remove the entire gland. Okay, for palatal pleomorphic adenomas, what I will do is I will try to do a wide local excision. I'll go wide, that is it should expose the periosteum. So I should expose it that much and I should remove the tumor completely. Okay, so this is the treatment of the pleomorphic adenoma. Either you can go for in parotid gland superficial total conservative parotidectomy or total parotidectomy if it is a carcinoma. And also in case of submandibular, I'll try to remove the entire gland, and for palatal, I should do a wide local excision. So now coming to the another one important thing. Okay, so these pleomorphic adenomas, okay, they have very less chance of changing into a carcinomatic one. So if there is certain mutations in certain genes like P53, it will turn carcinogenic. There are also other genes which are involved that can make this pleomorphic adenoma carcinogenic. I want you all to comment those genes, because see, nowadays the questions will be more towards the genetic aspects, because the students are becoming more smart and the examiner will try to put you under pressure. So you should be thorough with the genes involved in whatever situations it might be. It might be a tumor or any mutation or any genetic disorders you come across. The genes, the specific genes, the chromosomes is very important. Okay, so I want you all to comment what gene is involved that is changing the pleomorphic adenoma to an carcinomatous state, okay, to a malignant state. Okay, so this is about the treatment. And moving on to the complications, we all know what is the complications. There can be a parotid, the facial nerve injury, Frey syndrome, hematoma formation, and when we are operating submandibular gland, there may be a marginal mandibular nerve damage or lingual nerve damage. Okay, this is about the complications of parotid gland. So this will form the very basics of the salivary gland. And we talked about one most common benign tumor, which is nothing but the pleomorphic adenoma. I hope this video makes sense. Thank you so much for watching the video. Have a nice day.